Okay, good evening class. Today we're going to have a teach back on the chapters that were assigned for you to read for this week, which includes the blood, the heart, the blood vessels, lymphatic organs, right? So 4 chapters, very important chapters, for the simple reason that the number 1 cause of death in the United States and in the world is heart disease, right? So obviously you would expect a lot of questions when you take the nursing board exam on the topic of heart disease. As I have explained to you before, if you know what's normal, then you will know what is abnormal. Are we good? Okay, so before I proceed, I just want to double check again. Yes, it is. REC. REC means recording. Okay, so the heart. We know that the heart is a muscular pump. And what does it pump? Blood. And what is in the blood that's very important? The what? Okay, is plasma more important than oxygen? Okay. The oxygen that is transported by the red blood cell, right? Why? Because who needs the oxygen? The cell. In other words, every single cell in the body needs oxygen. Why? Why? To produce ATP where? In the mitochondria of the cell. So does that make sense? So the point here is that our knowledge should not be fragmented. Our knowledge should be unified based on what you have learned in the past. In the chapters 1, 2, 3, 4, particularly on the topic of the cell, we said the cell needs ATP produced by the mitochondria. In order to produce ATP, you need 2 things. One is oxygen, and the other one is the nutrients you get from the food you eat, such as what? Glucose, from carbohydrates, your fats, and your proteins. And if you review the chemistry, that is involving what? The citric acid cycle, where all the food we eat becomes pyruvate, and eventually it goes into the mitochondria to be processed as ATP. Okay? So, let's deal with the heart first. The heart is behind the sternum. Okay, everybody do this. Make a fist and put your fist in front of you. Okay? Now pretend that fist is behind the sternum. That is the size of your heart. Okay? The heart is retrosternal, it's slightly deviated to the left. What do you call the top part of the heart? The base. What do you call the bottom part? The apex. Right? And where is the exact location of the apex of the heart? Okay, 5th intercostal space, left mid-clavicular line. 5th intercostal space, left mid-clavicular line. Okay? So if the doctor tells your nurse, check for the apical pulse, what would you do? Look for the 5th intercostal space. Okay, everybody touch your left clavicle. Go ahead. Can you feel your can you palpate your left clavicle? Okay, look for the middle and drop your fingers slowly, gradually, slide downwards. 1, the first rib and the second rib, the first space between the first rib and the second rib is called the first intercostal space. Second intercostal space, 3rd, 4th, 5th. So that is the approximate location of where you are supposed to put the stethoscope and put the earpiece in the ear, look at the watch, and in 60 seconds, how many beats are there of the heart per minute? And you will learn why. Because in medicine, when we have a patient with heart failure, there is a drug we give, lanoxin. And I always tell my nurse, give this drug for heart failure because it will make the heart become stronger and make the heart beat slower so that instead of the heart running, you want the heart to just what? Jog and walk slowly, you know? So that's the reason why we tell them that check the apical pulse. If it's less than 60 beats per minute, do not give the drug. Because if it's 60 or 59 or 55, that drug might bring it down to 30, the patient will die, you will lose your license. Okay? So, the heart is protected by what? What protects the heart itself from the sternum? What is it that covers the heart and protects the heart? The pericardium. Okay? If you remember, the pericardium is a serous pericardium, or a serous membrane, which means a serous membrane secretes serous fluid. In this case, the name of the fluid is pericardial fluid. Oh my God, don't you love anatomy? It's so amazing. What's the name of the fluid? Pericardial fluid. Now, what secretes, therefore, the pericardial fluid?
Fraction between.
What?
There's a fraction between two layers, pericardium.
No, my question was, what secretes? I did not say what is its function. Gayani, so before you open your mouth, think, what is the question of Dr. Gamo? What is the structure that secretes the pericardial fluid? Huh? Yes, Mr. Toledo? Of course, the pericardial membrane. I'm just trying to find out if you really understood what you just told me. A pericardial membrane or pericardium is a membrane, and being a serous membrane, what does serous membrane secrete? Serous fluid. So it is actually the pericardium that secretes the fluid. Do you understand? I'm just trying to paraphrase and rephrase my question based on the knowledge you have acquired. Now, if you cannot understand, it's okay. That's why I'm trying to explain to you that pericardium is a serous membrane, and what does a membrane secrete? Serous fluid. So is your pericardium a serous membrane? Yes. Is the pleura in the lung a serous membrane? Yes. Is the peritoneum here a serous membrane? Yes. And it has two layers, visceral and? So which one is outermost? Parietal. Which one is innermost? The visceral. Right? The visceral layer. Now, what do you call the space between the visceral and the parietal pericardium? Pericardial what?
Space.
Is it called space or something else? Pericardial. Oh my God, Miss Ballet, you got it right. Why am I so concerned about proper terminology? Because we want to be accurate in the terms we use. Because why? To avoid confusion. Now, the space is a word we can use, but I would prefer you use what word? What word? What word? Is it a space? Is it the space between the visceral and the parietal pericardium? And what is found inside that space? Oh my goodness. And how thick should the space be? Or fluid be? What? How thick? Paper thin. What for? Now you can answer the question this time, Ms. Gayani.
To decrease the friction between two layers.
The what?
To decrease the friction.
Okay, to decrease the friction or reduce the friction, because it will act as what? A lubricant or natural KY. What is natural KY for? Lubrication. What for? Reduce the friction so that there will be no what? No pain. Every time the heart beats or pumps blood, am I experiencing any pain?
No.
So in behalf of humanity, I'd like to extend my gratitude to the pericardial membrane for producing that pericardial fluid, because that is what is important, right? So why do you need to know that it's only paper thin? Because anything in excess is what? No, abnormal. And what is that term used when there is excessive pericardial fluid? It's called effusion. What is it called? It can be due to pericarditis when there is infection or inflammation, right? Okay? So the bottom line here is that how can I be able to summarize the things I know about the heart? I don't know if did you watch, did you subscribe to my YouTube channel, Joel Gamo MD? Did you watch that, did you have the time to watch that video on concept maps where I spoke to the faculty members of West Coast? You didn't have the time, okay. Once you have time, you go there and look, and I was making all the faculty laugh at my jokes, but what I was trying to show them is this, a concept map. What exactly is a concept map? A concept is ideas, knowledge that you acquire. Why do you want to map it out? So that you can become more organized. Now I know you will say, Dr. Gama, there's so much overwhelming information. That's the reason why you have to organize your mind. It's a mind map. For example, if I put the heart here, one heart, I put the word pericardium, right? You know the heart is protected by the pericardium. I can put here what? Visceral and what? Parietal. Right? And what does the pericardium secrete? Pericardial fluid. What for? Lubrication, by reducing friction. I can put another arrow here and say the wall of the heart. What are the layers? So what would I put here? I would put 3. Okay. The innermost. What is the innermost? Then what's the next? Myocardium. Then what's next? Okay. What's another name for epicardium? Okay, visceral what? This one here is the same here. Right? You understand? The space between these two is called pericardial cavity. It contains the pericardial fluid for lubrication. Now what else? Now I go to the chambers of the heart. How many are there? 4. So you have right atrium, right ventricle, left atrium, and then what? Left ventricle. Right? 4 chambers, 3 layers of the heart wall, 2 layers of the pericardium. Now let's deal with the valves of the heart. What does the valve do? Prevent what? Backflow, or what we call regurgitation. And then allow blood to flow in one what? In one what? The band called One Direction. Remember the band? Remember the band? Somebody left the band, was it Malik or something? Okay. Prevent backflow. Okay, well, how many valves do we have? 4. 2 atrioventricular, which are what? Tricuspid and bicuspid, or otherwise known as what? Mitral. Which one is found between the right atrium and the right ventricle? Which one is found between the left atrium and the left ventricle? You almost hit the camera, my dear. Be careful. Is it okay? Okay. What about the 2 semilunar valves? What are they? Pulmonary and then what? Aortic. Which one is found right after the right ventricle? Which one is found right after the left ventricle? Okay. So now we know the walls. We know the chambers. We know the valves. So what is the best way to learn all this is by drawing with your own hand and your fingers, using your brain, and using your eyes, and using your hand and fingers, right? Okay. You don't have to make your drawing nice. In anatomy, I found it more, it's easier to learn if you use the whiteboard and this. This is the tool that will make you get an A in this class. I've been saying that ever since first day, right? Get the whiteboard, get the pen, and then do what I do. Okay? So, the heart has 4 chambers. What separates the chambers of the heart? The septum. So, up top you have the interatrial septum, and below you have the interventricular septum. Are you following me? So let's put a valve here. Tricuspid valve, mitral valve, or BV. Okay? Now, observe that what blood vessel brings blood to the right atrium? Inferior vena cava, and then what? Inferior vena cava. Be aware of that. And these blood vessels bring blood coming from where? The veins from what? Head, neck, and upper what? Limbs. All the veins, the head, the neck, upper limbs, they go where? Superior vena cava, which makes sense. On the other hand, the veins of the foot, the leg, the thigh, all the organs below the heart bring the blood via the inferior vena cava. So the veins of the abdominal pelvic organs, together with the thigh, the leg, and the feet veins, go to the inferior vena cava. It's like a freeway, you know, 5 north, 5 south, okay? 5 north, 5 south. The destination is what? Instead of LA, it's called RA. RA stands for what? Right atrium. LA stands for Los Angeles, California. So this is called RA, and the province or the state is heart. Right atrium of the heart. Now, where does the blood go? From the right atrium, it goes where? The tricuspid valve, right ventricle, and where does it go next? It passes to the pulmonary valve, Now, in your dissection of the pig last time, it was like this, right? It went like this, okay? In front of the aorta, and you have the pulmonary semilunar valve. The pulmonary trunk divides into two. What were they? Right and left pulmonary what? Arteries, right? Does it make sense? Okay, now, what's the name of the valve? Pulmonary semilunar valve. Once it reaches the lung, exchange of gases will take place. You exhale the carbon dioxide and you inhale the oxygen. The exchange of gases will take place, which I explained last time, between the air sac and the capillaries. Okay? So once you get rid of CO2, you inhale O2, the blood from the lung goes back to the left atrium via what blood vessel?
Pulmonary.
Okay, pulmonary what?
Vein.
How many pulmonary veins do we have?
2 for each side.
4. 2, right? 2 left, total of 4 pulmonary veins. You understand? Which you can see here, right? 2 pulmonary veins, 1 pulmonary artery, 1 pulmonary artery. Everything that's blue is venous blood, the oxygenated blood. Superior vena cava, inferior vena cava, right atrium, right ventricle, okay? Then it goes down into the pulmonary trunk like this. Pulmonary artery, it's all blue because they're rich in carbon dioxide. Once they go to the lung, exchange of gases takes place, coming back to where? Pulmonary vein, 2 on the left, 2 on the right. And why is it red? Because now it's oxygenated blood. Goes to the left atrium, bicuspid valve, left ventricle, goes up into the aortic semilunar valve, comes out here. Ascending aorta, arch, descending aorta. The descending becomes thoracic aorta, it pierces the diaphragm, becomes abdominal aorta. Which makes sense, right? Don't you love anatomy? What is the name of the aorta in the abdomen? Abdominal aorta. What is the name of the aorta in the thoracic cavity? Don't you love anatomy? You should love anatomy, right? So, apparently, therefore, let's make another diagram here. So from the left ventricle, the aorta goes like this, right? Okay? Pierces the diaphragm, the thoracic, becomes abdominal. Now, if I emphasize it in the lab, I don't know with the other labs, bear in mind that in the case of the aorta, the branches, on the left side, left subclavian, then left what? Common carotid, which probably we saw in the augmented reality thing, right? And then on the right, you have brachial what?
Brachiocephalic.
Brachiocephalic, which is not found on the left. This divides into 2.
Subclavian.
Right common carotid and right subclavian. Subclavian because sub means below the clavicle. What happens to the subclavian? Subclavian will change name. The subclavian becomes axillary because it's in the axilla. The axillary becomes a brachial because it's in the arm. Brachial means arm. Brachial divides into radial and ulnar branches, which makes sense. On the other hand, the left common carotid is what you palpate here in the neck. It divides into 2, external and internal. Which one will go to the brain? Internal, which makes sense again. External becomes the temporal maxillary artery going through the maxilla, which makes sense. And facial lingual arteries here, which when isn't just like in a human cadaver. Do you understand? Okay. Now in the common iliac is what is found here. Right common iliac, left common iliac. Why do you think it's called iliac? Because what is the name of the bone here? Yeah. Oh my gosh, don't you love anatomy? What's the name of the bone here? Iliac, right common iliac, left common iliac, internal iliac, external iliac, the external iliac becomes femoral. What's the name of the pulse? Femoral pulse. Don't you love anatomy? Okay? Now, so that is what it is, right? So, going back to this, therefore. The 4 chambers of the heart, you have 3 layers, endo, myo, epicardium. The heart has what they call pacemakers. You read about the pacemakers of the heart? What is considered the primary pacemaker of the heart? Which is the heart. On the right wall, right atrial wall is the SA node, which is the primary pacemaker which sends an electrical signal or impulse to the muscles that the muscles will contract. What is the term used when muscles contract? Systole. What do you call the term when the muscles relax? Diastole. Okay. Okay, so the primary pacemaker is the SA node, then the AV node, then the bundle of what? His, then right bundle branch, left bundle branch, then Purkinje what? So which one therefore will make the ventricle muscles contract? The Purkinje fibers. Which one will make the atrial muscles contract? The SA node. The SA node. Okay? So, when you become future nurses, are you going to be assigned in the intensive care unit? You will. One of the things we normally tell the nurses to do is look at the electrocardiogram. Electrocardiogram. Electro means electrical activity, cardio means heart on a monitor. Cardiogram means you're recording, right? Erase this. Remember this? I'm going to sing a song. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, and me. We're gonna study the ECG. Boys and girls, come sing with me. Let us study the ECG. ECG, electrocardiogram. Some would say EKG, electrocardiogram. Each of these represents P wave. Two things, electrical event and the mechanical event. Which one will be first? Electrical, because you have to stimulate the muscle with a nerve impulse. Right? Okay? So this represents atrial, what they call depolarization. Depolarization means electrical stimulation in simple terms. So it will make the muscles what? Atrial what? Systole. Contract. What about the QRS complex? This one here, QRS.
Ventricular depolarization.
Okay, ventricular depolarization. And what will be the next step? The muscles contract, you have ventricular what? The muscles in the ventricles will contract. And what is the T wave representing?
Repolarization.
Ventricular repolarization. What is the opposite of systole?
Diastole.
Very good. Now you might be wondering, do I need to know this? You have to. When we leave the patient in your hands as nurses, we have to know what exactly is that. It's not a work of art. It's not a painting by Picasso or Vincent Gamow. I'm Dr. Gamow, okay? So take a look. When you look at the patient's ECG like this. Chig-jig, 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 chig-jig. This is this. I just extrapolated it, expand. This is this. This is this. Observe the distance from here to here and here to here. Regular sinus rhythm. What's it called?
Regular
Sinus. From the word sinoatrial node, where is it? SA node, sinoatrial node, right? Rhythm. Do we want our patients to have regular rhythms?
Yes.
Yes or no?
Yes.
So what is arrhythmia? No rhythm. Means without rhythm. So like this. Like for example, remember I think you answered about the MI. When you have an MI, the coronary artery is the one that blood supply to the heart, right? Right and left. What happens if there's not enough blood flow to the SA node and the AV node and all these? Then you end up with an arrhythmia, irregular rhythm or absence of the rhythm. So it will be something like this. So instead of like this, it will be what? It's okay, there's no money there. Atrial fib becoming ventricular tachycardia, ventricular fibrillation. And what is a flat line? A flat line, there is no electrical what? Impulse. And when there is no electrical impulse, no mechanical event. That means you are in a cardiac arrest. That means it's a flat line, means you are in cardiac arrest, muscles are dead. And you are dead. Right?
So if you cannot recognize, I will cry. And you say, oh, the patient is okay, flat lying. I'm just joking.
Worst thing.
You understand? So what do we tell the nurse? Code blue, code blue. Of course, I'll be shouting. Crush cart, defibrillator. Stand clear, I'm clear, you're clear, everybody clear, 300 joules. 300 joules, stand clear, I'm clear.
If you're lucky, if you're not lucky,
no response, no response. Time of death, 5:55, July 30th, 2018. May he rest in peace. I don't normally say that, but the bottom line is, despite heroic efforts, the patient passed at 5:55. You understand that we are here to do our best to save lives, right? Is that clear? So the bottom line is that the things you learn, like example, the right and the left coronary artery. I forgot to put that as the most important one. What's the blood supply to the heart? How many are there? There are two. One on the right, one on the left, as you can clearly see here. Now where do they come from? The aorta, right and left. And they have many branches. For example here, the left has the left anterior descending branch, LAD. The other one is called the left circumflex branch, goes to the back. And the right is in the right side. Goes to the right, become the PDA. What is PDA? Public display of affection. No, I'm just joking. Posterior descending artery, which is found here. So if the doctor says, you know what, you have an anterior wall MI, I will tell the nurse, the patient has an anterior wall MI. What does an MI mean? The anterior descending artery, the left, is completely blocked with two things: fat deposit and a complete blood clot. Complete. That's why there is no oxygen, there is no blood flow. What happens to the muscles here? They all die. That's called MI, heart attack. What about myocardial ischemia? Ischemia is not MI. Ischemia is a term which means what? Myocardial ischemia decrease what? Coronary what? Artery blood flow due to athero what? What is atherosclerosis? You probably read on this on your discussion board, right? A person like me, I don't take care of my body. I have so much excess fat. I do not exercise. I have a sedentary lifestyle. I like to go to McDonald's, Panda Express to eat and eat. And where do the excess fat go, aside from my abdominal wall? In my coronary artery, right? And as time goes by, next year, 2 years from now, 3 years from now, the fat deposit gets bigger and bigger. What happens to the blood flow? Decrease. Will I suffer from angina or chest pain?
Yes.
Will I go to my cardiologist and say, I have chest pain? Substernal, radiating to the shoulder, to the arm, the forearm, the hand, and the jaw. That is chest pain of cardiac origin. Will the doctor do an electrocardiogram? Will the doctor recommend that we examine the cholesterol level for LDL and HDL? Yes? Will the doctor give me drug to lower my cholesterol levels? Yes. Will the doctor give me a drug to relieve the chest pain called nitroglycerin? Very good. What does it do? It vasodilates. What will it do to the blood flow? Increase the blood flow. Will that relieve my chest pain? I will tell the nurse, thank you, nurse. What did you do? What did you give me? Dr. Gamo, I gave you a nitroglycerin, which is can be given under the tongue, called sublingual, or in the form of a medication skin patch. Now, why would it be effective here and here? Because what are found here? Blood vessels. What are found here? Blood vessels in the skin. So the same pathway, see? Remember? Head, neck, upper limbs. All the veins, capillaries are everywhere. So they will go to the same pathway, right? You understand what I mean? So apparently, because people think, if I give the drug here, it will go directly to the heart. No, 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 no. Once it goes to the skin has blood vessels, it will travel skin, the veins there, the vena cava, and so forth and so forth. If I give the drug here, it will go to the capillaries, then the veins, and then to the superior vena cava, right atrium, right ventricle, to the lung, then left ventricle, then aorta, then what? the coronary arteries. It takes a long path, but it doesn't matter. You should be able to trace how the blood travels. From the veins, the right side, then to the lung, then to the left side, aorta. What is the ultimate goal? To dilate what? And what is the first branch of the aorta? Coronary. Isn't it amazing? Have you ever realized that well, I'm not saying the heart. If the heart could think and speak, this is what the heart would say. What do you think of me, stupid? Who do you think should be given the first blood? Me or the brain? Me. So whenever the heart is pumping blood to the brain, it will actually pump blood first to itself. How? Chug-jig. Coronary. Chug-jig. Chug-jig. Isn't it amazing? Have you ever realized that every time the heart pumps blood, it's actually pumping first to itself before anybody else? Because it has to, because why? Does the heart have a Christmas break, spring break?
No.
It does not have any break at all. Whether you're awake, asleep, making poo-poo, making wee-wee, having sex with your wife or husband, it will pump and pump and pump. No rest at all. It will only rest when you rest in peace. I look forward to the day when all I need to go is to go to Walmart, okay, large size of heart, okay, and then I will replace my heart. I would believe that will happen eventually. I remember this guy's name was Dr. Jarvik. He tried to come up with an artificial heart. That hopefully 10 years from now there will be a heart called Dr. Gamo's heart, which he will manufacture and sell in Walmart. The idea here is that it's a pump, so we're based on principle. The only thing we cannot follow and imitate might be the electrical stimulation. Can you imagine if I put a pacemaker there? Well, anyway. There's one in the YouTube with stem cells creating a new organ. Isn't it amazing what they can do nowadays? Do you have any questions regarding the heart? Okay. So make sure you know about the things I mentioned now. Blood. Okay. Blood is made up of two things. What makes up the blood? Form elements. Very good. So let's erase this. Plasma and what? Very good. Right? And again, let's make a concept map. Blood. Form elements. And what? Plasma. Most of the plasma is mostly what? Water. And what are the components there? Plasma, proteins. And of course you have electrolytes, sodium, potassium. Under plasma proteins, what are the examples under plasma protein? Albumin and globulin. Now, which globulin is important for the defense against infection? Which globulin? Who said immunoglobulin? They're so proud of their answer. You are absolutely right. Can you tell me another name for immunoglobulin? Oh my God, this is a very smart class. And what do antibodies do? Fight against the bacteria or the virus. Is that important, therefore? Yes, it is. Albumin and globulin also contribute to what? Osmotic pressure. If you have talked about this before. Okay? Now, what else are part of the plasma proteins that I want you to tell me?
Fibrinogen.
Huh?
Fibrinogen.
Okay, what is fibrinogen, my dear?
It's for butter. It's for
What is fibrinogen, Ms. Gayani?
protein.
It's a protein, I understand, because it's under plasma protein.
It's for clotting factor.
There you go, it's a clotting factor. And where is this produced?
Fibrin.
Fibrin. Huh?
Let's make fibrin.
Where is this produced? Again, you have to... Miss Gayani, listen to the question. I didn't say what happens to it. I said, where is it produced?
In the liver.
Very good, Miss. At least you were able to recover. Produced where?
Liver.
Where?
Liver.
There?
Liver.
Liverpool. So what is the... Okay. So you just do not realize. If you know your anatomy, there is no question in the nursing board exam that you cannot answer.
I'll tell you why. If you know that the liver produces clotting factors such as fibrinogen and plasmid, which are plasma proteins, what happens when you drink too much alcohol or when you have hepatitis, you have liver cirrhosis and scar formation, destroys the liver when you have liver failure? Will the liver be able to produce clotting factors such as fibrinogen? If there is none or less amount of clotting factors, will your blood be able to clot? If your blood is not able to clot, you will what? Bleed. Can you see that in skin lesions of patients with liver cirrhosis? Like spontaneous hematoma, spiderweb appearance of bleeding. I don't have to mention that, you don't have to spell it because it's very long. Spider angiomata and telangiectasia. The bottom line is, when you go to core nursing, you will learn that if you handle a patient in the hospital with liver cirrhosis and liver failure, the reason why they have bleeding manifestations is because of what? They cannot produce the clotting factors, and therefore the blood will not clot the blood. You end up with bleeding. You see what I mean? Now, under form elements, you have what? RBC, YBC, platelet. Is the platelet a cell?
Yes.
No, not cell. Why? It's a what? Fragment. Fragment of the megakaryocyte, which is a cell. There's reasons why before we used to call the platelets a thrombocyte. What does thrombos mean? Clot. A stationary clot attached to the wall of the arteries. That's like when you have coronary. So we no longer use the word thrombocyte because cyte means cell, but the platelet is not a cell. It's rather what? A fragment of a cell. I want to be in focus because sometimes if I go like this, okay, at least you can hear my voice, right? But its important function is for what? Blood what? Clotting. So you therefore bear in mind, in order for the blood to clot, you have two things. Platelet and then what? Clotting factors. This actually is more of aggregation. So when you have a blood vessel like this, the blood flows here, you have a wound, the blood will come out, right? What will the platelet do? The platelet will come together right now over you. It will aggregate. So, was it the Beatles song? I don't know. This will aggregate there to act like a temporary what? Plug, exactly. You know, just like when you have a, you understand? So what happens if your platelet count is low?
Bleeding.
You could bleed. It's called thrombocytopenia. And the levels are below 150,000. What do you think Dr. Gamo will do? Transfuse what? Platelet. Concentrate. Transfuse platelet. Then we need to find out why is your platelet count low. What organ will I examine?
Bone marrow.
What?
Bone marrow.
Okay. You're an LVN, right?
No.
How come you know these things?
More than that.
Of course, you do a bone marrow aspirate. Yes, he's right. BMA. Painful. Because we're not to know, we want to know. In the field of medicine, it's not just giving you what you need, but knowing why is this happening to this patient. We always ask questions why, where, when, how it's happening. So we have to examine the bone marrow, which is the source of all these foreign elements. Bone marrow, which one? Red or yellow? Red. Okay. Red blood cell. Red blood cell is important because the hemoglobin means that's what? Protein, right? 2 alpha chains and 2 beta chains. A delta chains, which means that it can carry what? 4 oxygen molecules. Inside is a porphyrin ring called the heme, H-E-M-E. Globin means protein, alpha protein, and beta delta. The heme is the porphyrin ring, which in the middle is the iron, where the oxygen is attached to. Okay? That's why in order to have good levels of RBC, do we need to have iron levels that are normal. That's why if you have iron deficiency anemia, which is the most common, especially among pregnant women, what do we give these pregnant women? Iron in the form of, what is the chemical name of iron? Fe, ferrous sulfate. You understand? Okay. Now, of course, white blood cell. The white, I will put it up here. You have two types, granulocytes, and then what? Granulocytes, which means it is the nucleus, the cytoplasm has granules, no granules in the cytoplasm. Under granulocytes, you have three, neutrophils, eosinophils, and then basophils. Now remember when I gave my midterm exam, I came out in my quiz in the lab, which one is important for elevation in bacterial infection? Neutrophil. Elevated in bacterial infection. The neutrophil is also known as polymorphonucleus, or PMN, or sometimes we call it polys. There's a polymorphonuclear, polys, PMN, the same thing as neutrophil. The moment it's elevated, we have to suspect that it could be dealing with what? Bacterial infection. Now, why am I giving you all these names? I'll tell you why. A 70-year-old male patient was brought to the hospital, admitted, community-acquired pneumonia. I told the nurse I want a complete blood count with W differential count. What do you mean by W differential count? CBC means complete blood count. I want to know all about these values here. And WBC differential count means I want to know the values here too. W differential count. If this is elevated, we have a high index of suspicion that we're dealing with what kind of infection? Bacterial. So coughing, sputum, we send a specimen for culture and testing. What organism is causing the infection? Do you understand? Now, what about eosinophil? Two things. Parasites, and then what? Allergy. Very good. Basophils, allergy. Has to do with the word histamine. Remember the word histamine?
Yes.
That's why we give what kind of drug to patients with allergy? Anti-histamine. Oh my God, don't you love anatomy? You give antihistamine. Benadryl, whatever. Okay? Do you understand? Eosinophil, parasites, allergy. When I say parasites, it's a common here in the US, but in third world countries, improper food, sanitation, hygiene, food that is contaminated with what? Ascaris worms, and those like spaghetti worms grows in your large intestine. Some of them won't come out here, some of them won't come out in the poo-poo. Okay? Do you understand? Now, blood typing. Your blood type is based on your what? The antigen on the surface of the red blood cell, right? Okay, right? For example, blood type, red blood cell is the important thing here. A, B, AB, O. Your blood type is based on the antigen or agglutinogen that is found on the surface of your red blood cell. Okay? The red blood cell here, what is the antigen here? A. What about here? B. Antigen. What about AB? A and B. A and B. What about O? Zero antigen. Zero antigen. So zero antigen, and because of that, it is considered the universal what?
Recipient.
Donor or recipient? Donor or donor?
Donor.
Okay, very good. If this is the cell, what is found around the cell? The plasma. What is found in the plasma? Antibodies. Antibodies. So you have the antigen there. What are the antibodies here? Surrounding the cell.
B for A.
Antibodies, this will be anti-what?
B.
Anti-B antibodies. Anti-what? A. Anything that has A. I hate this. I hate that. Don't you ever give that to me, because I am what? A proud B. Anybody who's B here? Give me a B. You're a B. Give me your phone number later after the class. You, Miss Ballet. Are you also a B as in Ballet? B Ballet, B B? Only the two of them? Okay, I need their phone numbers because tonight if I go home, I meet an accident on the freeway, I'll be calling you on the freeway, I'm bleeding. I need blood transfusion, the two of you, can you donate? If you say no, it's okay. Then I will die. But if you're going to donate your blood to me, I will appreciate it, okay? Only two people will be here. I don't care about you. Okay, you're the third person. I love three of you, okay? Only because we're blood type. Okay, I'm just kidding. My wife is B, my kids are all B's. So.
What if we can give to everybody?
Who is O here? My second choice is O, okay? Do you see how many you are? So many of you. That's the reason why you're so many, but you are not lucky. I'll tell you why.
We can't give like
okay.
everybody can twist it.
The O is...
We can only give them.
The O is very generous. Unfortunately, what do they have in the antibodies? Anti-A and anti-B. Oh shit. Apologize, video, YouTube. That means nobody else can, because anti-A, no A's. Anti-B, no B's. Anti-A and B, OMG. In other words, the only way that they can be given blood is another O. Okay, raise your hand again. So many of you say, don't worry. Okay? You don't even have to call the number, okay? Now, what about AB? Who is AB here? Oh, AB, huh? AB, what do they have? No antibodies, which is good. Why? Because they're universal what? They're good, huh? They're the universal what? So what do I mean by that? Very simple. Like me, this is Dr. Gamo here in the bed, right? I'm B. So what is in my red blood cell? B, and what is in my plasma? Anti-A in my plasma, right? That's me. So if somebody gives blood to me, let's say student with type A, what will be given to me would be her red blood cell. So, her red blood cell has A. Like this. So what do I have here? So the moment you have this infusion of BT set or blood transfusion set, the moment the blood is given to me, the red blood cell, the moment it enters my veins, that's like Star Wars. Enemy approaching, interceptors immediate launch. The anti-A antibodies will attack the red blood cell. And what will happen to the red blood cell? They will clump or agglutinate, and then eventually they will rupture and burst. Where? In my body. In my veins. Who's gonna suffer? Me! Because you gave me the wrong blood. And if I die, I'll come after you. Now, this is the reason why this will come out in the nursing board exam. How critical thinkers you are, how much critical thinking. Not only that, I think it's being done here too. In the Philippines, whenever we do that, we have what we call proper cross-matching. What does it mean? I told the nurse, I want blood type B for Dr. Gamo, right? What are the chances of the technician in the lab made a mistake? Instead of labeling the bag of blood B, it was actually A, but put B, but it was actually A. Can that happen? So what happened is that whatever blood you plan to give, get the sample, then confirm, is Dr. Gamo really B? Then that's it, you cross-match. Now, in some, like in the Philippines, what we have is this driver's license, this blood type B. I don't think we have that here, right? How many of you here do not know your blood type? Why are you in nursing school? You don't even know your blood type. Now, you have a question?
I was going to say, but that's only pertaining towards like red blood cells, right? Because, I mean, plasma you can still transfer, like I know you can actually receive from any blood type.
As long as there is, because the antigen is anti-A against the A red blood cell, okay? Now, this is one thing you have to know. There is what they call RH, and what is RH? Okay, RH is different. RH is from the word rhesus monkey. If you are RH positive, you are related to the monkey, like me. I'm related to the monkey. So sometimes do not be surprised if I go, okay. I'm just joking, okay? Rhesus monkey. I am, what is my blood type? B positive. That is Rh positive for me. If you are A positive, that is ARH positive. How many of you here are RH positive? Are you B?
I'm AB.
AB positive. Who is positive? Okay. Who is RH negative? Okay. If you're a woman, watch out. I'll tell you why. If you're a man, it doesn't matter. What's another name for RH? RH or what? D, as in dog antigen. Okay? In other words, aside from B, I have RH. Now, there is no letter RH in my cell. It's just a representation, symbolic of the RH. I think there's a specific configuration there. So I have B, 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 RH, 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 that's why I'm RH positive, and I'm type B. Now, this is the problem. If I have sex with a woman who is RH negative, and here is Dr. Gamo is RH positive, is there a problem here? There is a problem here. I got her pregnant. The first sexual encounter was very successful. She's a very good catcher of the sperm. She got pregnant. The first pregnancy, the baby happens to be what? Just like father, RH positive. Okay? So the father is RH positive, which happens to be me because I am RH positive. My baby is RH positive. Is there a problem here? Yes. There is, because the mother is negative. There is no compatibility. Okay? So, during what? Placental separation. Remember I showed this to you before? Vagina here, vagina here. When the baby comes up, oh shit, mom, hurry up, hurry up. The baby is safe, I'll tell you why. Because the moment the baby comes out, and the baby would say, hurry up, mom, the placenta is following me. The placenta will come out next, followed by the umbilical cord and placenta, right? A sudden gush of warm blood, lengthening of the umbilical cord. It will come out in the nursing board exam, which made this placental separation. The endometrium. When the placenta separates, is it possible for the blood of the baby and the blood of the mother to mix? Yes. Houston, we have a problem here. Why? The moment there is placental separation and you have mixing of blood of mom and the baby, the mother will develop antibodies against RH antigen. But the good news is that the first baby is what? Safe. Safe because it's already out. That's what did you say? Thank God, mom, I'm the first. Who will suffer? The second baby. Why? Again, father, me, mother, RH negative. They get pregnant. The child becomes RH positive again. What will happen? The antibodies here, is it possible for it to mix in the 3rd month of pregnancy and during placenta separation? So what happens now? When the baby is born, or last 2 weeks of pregnancy, if the antibodies is able to cross the placental barrier, the antibodies will attack the red blood cell of the second baby. They will again clump, aggregate, and then burst. Burst means hemolytic disease of the newborn. Okay, what is it called? Hemolytic disease of the newborn. What is it called? What is it called? You can never tell. You might expect it today. Now, what's another name for this? It's called erythroblastosis fetalis. Now, why the hell am I giving this to you? What happens in the nursing board exam? If this does not come out, what will come out is this, and you would say, you would scratch your, what the heck is that? They mean the same thing. Now, what is the drug of choice for these patients? What do we inject them with?
Rogam.
We inject them with what? Rogam. What is gum? Gamma globulin. What is this? Synthetic. What is synthetic? Man-made form of antibodies, like vaccination or immunization. We inject this drug. What does Rho mean? Rho means RH. Gam means gamma. I'm just kidding. Gamma globulin. First pregnancy, you inject. 7th month pregnancy and during what? Labor and delivery, 2 times. Same thing with this to prevent the death of his second baby. Do you understand? But the most important thing is awareness. Some of you said you were RH negative. Some of you don't even know your blood type. How many of you do not know whether you're RH negative or positive? Raise your hand. There you go. Be honest. Okay. So why? So let's pretend you want to have sex with your partner. You go to a motel and you're about to remove your underwear. And then, oh shit, I remember what Dr. Gamo said. Honey, what is your blood type? Are you Rh negative or positive? Honey, I do not know. Abort, abort, abort. Tomorrow, the first thing we do, we go to the lab and have your blood type tested. And then after that, we can have as much sex as we want. If you're negative, we will call Dr. Gamo. Would you recommend? No, I'm just kidding. The idea here is that knowledge is the power to transform your lives. If you do not apply, then somebody says, Dr. Gamo, isn't that routine to check for arrhythmia? It could be, what if they miss? And you are wondering how come the first baby is dead, alive, second is dead, third is dead, abortion, abortion, abortion. That's the reason why. There must be a reason. A reason, oh why, oh why, oh why, oh why, oh why. Abortion, second, third, and fourth. You understand? Okay, I will give the floor to Christopher here. I will come back, okay?